Hello, just waiting on people to come in. Have we got everybody in? Numbers are still going up. Wow, it's a popular session. Just give us another minute or so while the remaining attendees enter the session. Okay, well, I think we're ready to start, aren't we? Team, are you there?
Yes, and excited to chat about the Global Masters in Public Health.
Very, very cool. So I think it might be useful if we introduce ourselves first. So my name is Professor Paul Aylen. I'm a Professor of Epidemiology and Public Health at the School of Public Health at Imperial. And I'm a co-director of the course along with Helen Ward. Kat, did you want to introduce yourself? Is Helen there?
I don't see her, so she's probably just joining on.
Okay.
But my name's Catherine Collett, and I'm the Senior Teaching Fellow on the Global Masters in Public Health. So my job is to help coordinate the program, help it run smoothly, and to work with all of the students along the way. Can I hand it over to Anna to introduce herself?
Hello, my name is Anna. I am a coordinator for the program. I am part of the program support team, so working closely with the students.
Great. And we've also got Christina.
Yes, hi. My name's Christina. I don't know why my video is not showing. Apparently the host has to enable my video. But anyway, so I'm Christina. I am a Principal Clinical Academic Fellow in the School of Public Health. And I'm also the senior tutor across the talk programs within the School of Public Health.
Brilliant. And we've also got Patson and Amber here. Patson, do you want to introduce yourself?
Yes, hi everyone, I'm Patson Godino. I'm the online administrator on the GMPH program. I work with admissions, student enrollment, and also supporting program delivery on Coursera.
Great. And Amber, would you like to introduce yourself?
Hi everyone, I'm Amber Carvey. I'm a teaching fellow on two specialisations, so HSD, which is Health Systems Development, and the Global Disease Masterclass, which is also known as GDM.
And we've also got Helen Ward, who's just joined us, who is my co-director on the course. Helen, do you want to introduce yourself? Helen, you're on mute.
Sorry, I was sitting in another room on my own, wondering where everybody was. Anyway, hello, I'm Helen Ward. So yes, I'm Professor of Public Health in Department of Infectious Disease Epidemiology, and with Paul, I'm co-director of this. I also work with Amber on the Global Disease Masterclass, and I run the Participatory Approaches in Public Health specialisation. So welcome.
So welcome. So we've got a packed agenda lined up for you. I don't know if you just want to go back to that last slide. I'm going to give a little overview of the course, and then Kat will talk about the mechanics of the course, and then we'll have some questions and a few slides about admissions and how you apply, and then an example of the global health innovation specialization to give you an idea of how elements of the course are structured. So, well, this has been a relatively long journey. I think we came up with the idea of an online course about 3 years ago. We run a very successful on-campus Masters in Public Health at Imperial. And that's been going for at least 10 years, if not longer. And essentially, we were running out of space and capacity to teach students on campus, and we were looking around for ways to expand our teaching, and perhaps more generally to fulfill one of the remits of the school, which is to help assist train, educate, and give people the public health skills to go off and do good stuff and improve public health. So the option that we came up with was an online course, which gets around the physical space element. And we work very closely with our partners at Coursera to build what we hope you will find is a really well-designed course. We launched the course in September last year, so we've got the first cohort going through our course, and I know they're finding it interesting and entertaining and stimulating. But we work very hard in order to not just take the on-campus material and convert it to an online course, but to use the on-campus material as a basis, but really design a completely new, bespoke online public health course. And that's involved really going back to basic pedagogic principles in terms of defining who our students, who we want our students to be, deciding what we think they should need to know in order to practice public health, and then working back from that in terms of building the course. And the course is built of a number of elements, which Kat will go through in a little bit more detail. And we launched with a 2-year part-time option of this course. We call it part-time, but it's actually quite a commitment in time. Our on-campus students do the course in a year, but they're essentially here with us full-time doing their learning. Whereas the online course is over 2 years, but we'll talk about other options to do that as well. But it's over 2 years, but really that's probably amounts to about 20 to 25 hours learning a week. So that is a fair commitment, even though it is part-time. But a lot of it is delivered asynchronously, so you can, to a certain extent, learn at your own pace. Although we have a number of live webinars and assessments obviously have to be in at times. So there's a certain pace to the course that you need to keep up with. One of the challenges of delivering an online master's course was the summer project, or the thesis, which is a sort of integral part of our on-campus course and forms a third of the course. And we had to really rethink and replan how we deliver the research component of the course, which again is an integral part of this this online degree. And for that, over the course of the last 4 terms, so it's a 6-term course, we take you by the hand in developing your own research project, and support you all the way through from developing a question and doing your background research to taking you through choices of methodology and practical approaches of research. Such that at the end of the degree, you will have the equivalent of a master's research project with a good research question, a background literature, a methodology, your analysis and results and conclusions, written up finally as in the form of an academic publication. So we've taken a lot of thought about both the research project and the other elements of the course. The degree itself is very sort of evidence-based. It's quite research based, so the focus is perhaps on evidence and research, which we think is one of our more unique selling points on the course. And what we're, I mean, ultimately, my vision is that at the end of this course, you are equipped with the skills that you need, not only to practice public health, but with the option to go further into academia and further into research, and at least have the skills to be able to interpret public health research to inform your own practice. I'm just going to ask Helen, did you want to add anything to that overview of the course? Kat's going to talk about the detailed components of it.
No, I think, I mean, that covers everything really. Just that there is flexibility is the only sort of thing I would add in terms of, as Paul mentioned, there's core things that everybody studies, but then there is some flexibility of choosing some of the options, which does mean it can really, you can select some of those things that you're either particularly interested in or things that you particularly don't know anything about. If you've already got experience, there may be things we cover that you don't feel you need extra on, and you might want to do something really different. So things like the infectious disease modelling has been, is a popular one for people who are of a mathematical persuasion and are interested in how you understand the transition dynamics of infectious disease outbreaks, for example. So they're
very popular
flexibility
for some reason, Helen, I believe.
Yes. So yeah, I think that's the only thing I would add. But yeah, I think you'll hear more about the detail from Kat and from Amber in a minute.
Yes, yes. And Amber will actually give you an idea of how a course is put together and how a student might experience it. So so I'm gonna hand over to Kat, who is going to just give a bit more detail on the makeup of the course.
Fantastic. Thanks so much, Paul and Helen. As we mentioned, this is so we've started with a 2-year part-time course. So I'm going to go through the course, all of the courses that are covered, or the specializations as we call them, that are covered, and then tell you about how you might join our program in a very different way on the PG certs that dip or stack that credit all the way up to a master's over 3 years. So as you can see here, we have some courses that are in green, and as Helen mentioned, these green courses are our core courses. So you will take all of the courses over the time that you study with us. We additionally have, and we really feel like these build to everything that you need to know as a public health professional and practicing it when you move into the world, whether that's in academia, policy, working with an NGO, working domestically, or working internationally. So it's really that theory that you need. And we give you opportunities to apply that theory as you go along, and I'll talk a little bit about assessments at the end here. So you'll start with Global Disease Masterclass, Epidemiology for Public Health, and Foundations of Public Health Practice. And I think this is a really nice, hard-hitting semester that gets you acquainted with Imperial College, what we expect of students, and really into the master's program as a whole. After that, you'll get to start taking some electives, and so you'll see Statistics for Public Health and Health Systems Development as our core courses in the next term. And then you'll see here that you've got an opportunity to take one of 4 elective courses. And I think what you're starting to see as we're building this is that we really are covering all of the areas of public health, and that you get an opportunity to do some quantitative and some qualitative or some more social public health driven courses. And so if you're not terribly quantitative focused, you don't have to continue to do that. So in this next term, we've got Global Health Innovations, Infectious Diseases Modeling, Quality Improvement in Healthcare, and Health Protection. You'll then move into the next semester, which, as Paul rightly mentioned, you'll start your research portfolio. So in that semester, you think about designing your research question. You'll then move on after that to think about your research methods. So what approach are you going to use? A qualitative approach, a quantitative approach? In those different methods, what specific tools are you going to use? How are you going to really build this project by yourself? We'll really stepwise take you through that, and we support you going out thinking about where you can find data publicly available, or who you might be working with in a hospital, or maybe you're interning somewhere, and really building that question up, something that you're particularly interested in. The next semester is really practical. So you'll see we're moving across the top here, and we're thinking about the core research skills here. So you'll do your ethics. That'll be thinking about ethical research and what you need to propose to an ethics committee. And even if you don't need to propose ethics, you'll get to have some experience with that, and you'll be ready to put in ethics if you need it. Then you'll go on and you'll think about the proposal writing. So obviously in this situation, you're writing us a proposal, but you may be in a situation in the future where you'll need to write a grant to a funder of some sort. So we want to give you the skills to do that in our course. And finally, we'll think about what participatory approaches you might be able to use in research, because we feel like that's a really core element and something that's often skipped out on other programs. Finally, you'll write your actual dissertation. And what that is actually a journal style article. So you'll have built everything up to this point. You'll have a background in a literature review, you'll have your protocol, you'll put in your ethics, and now you're ready to go. And at the end of that, like I said, you'll write a journal style article, which can have policy implications, it can have more academic implications, and essentially what you're trying to do is fill a gap in the literature and the research that's out there at this point. And so then going back a little bit, you can see that we've got a few additional core courses: population health improvement, global health challenges and governance, and health economics, as well as a number of different additional electives, including digital health, participatory approaches in health, which you'll get a bit of a flavor in Research 3, but if you really want to dive into that deeply, you might want to pick it in this term, and life course in public health, where you look across the kind of human life course at various different subjects. You'll notice here again that you'll go back and be able to repeat and reselect from the first 4 core courses, or sorry, elective courses, and pick another one. Obviously, you won't be able to take the same course, but you'll be able to pick a new one. So this gives you an opportunity really to dive into some of these courses that you didn't do in the first elective term. So that's the overview of a course as a whole. As Paul mentioned, it really is, it's rather intensive, but I think it is designed so that someone can do it while they work. Obviously thinking about, your work-life balance, your home life balance, and various other things. Our students at the moment really are working, they're working in public health and non-public health, and we'll talk a little bit more about admissions as we move forward. But overall, this is designed so that there is a bit of flexible study, but as Paul said, you do have to do assessments in a specific order, and you do have to take the courses in the term that they come. So the next option that we have is a new option, and it's just opened up recently. So if you have come to a webinar before, you won't have seen this and we won't have discussed it, but you may have gotten some promotional material, or you may have now seen it on our website or the Coursera website. So if this is something that you're interested in, we really do suggest go on the website, apply for it. If you have already applied for another program and would like to switch on to this program, please let us know immediately so that we can do that for you. So what you'll see here is that the courses that you're offered are done at a little bit of a slower pace, but it's still the same core and elective courses. So the PG Cert is 30 credits worth of a course, and that's not really something that we need to focus on. But the idea is that you take a smaller proportion of the courses as you kind of, if you want to, build up to a master's degree. We know that some people actually really would rather just take a certification. They want to get introduced to public health. Maybe they want to see what it's all about, see if it might be something they'd like to move on to a master's degree in the future, or actually they realize these core concepts and these core theories are really helpful for them in their practice. And they may be folks who are already in public health, and that might be really good for them. So if you do complete this over the course of 1 year, then you you can complete it over the course of 8 months to about 2 years. So if you do need to pause in the middle there, that as you can see, the course is set over the course of 1 year. And so we really strongly advise folks, if you want to go on this certification route, that you actually do try and study over the course of the year itself. When you come out, you'll get a certificate from us that says that you've completed this course set of courses. And you can go on and go back to work, use this in any way you want, or you might want to then go into a PG diploma. So the diploma then adds additional courses to the course of study. You'll see here that you then go back and join us in another year. You can see here at the top, there's additional ECTS's worth of credits. Again, not important to think about these in terms of the numbers, but it's really just showing you that you take additional classes as you go along. And you'll be able to then continue this. And often we find that folks do this within an 18-month period. Now, it's important to point out that on the website, it does have all of the specifications for how short of a period of time, which is 2 years in this case, to how long of a period of time that you can take to complete this course. And so it's important just to keep that in mind as you make a decision. And in this case, it's 18 months. So again, this is really just adding more flexibility to the program, and we really wanted students to be able to come in and out as they wanted, to maybe test out some of our open content, and then join us for various different kind of degrees. And then we'll talk more about the admissions here as we move forward as well. So as we've kind of discussed, you can do the PG certs to the PG dip to the master's program. And what that looks like is a course of study over ideally 3 years. And what you'll see here is that all of this in green and in yellow is your what we showed in the last slide on the certification and the diploma. And then what you'll see is the last component to add here is the purple, which is the research portfolio. So again, as you move forward, you're able to continue to add to what you're learning, continue to stack those credits, and at the end of the day, get a master's diploma from us. So with that, I'm going to go back a little bit to the kind of pedagogy that we use. So obviously this is fully online. We do have some live sessions that you can join, but we recognize not everybody can do that. So we've really built the courses that they can be standalone and have lots of points of contact for you through office hours and various other methods. And Christina will talk about this a little bit more. But again, as Paul had mentioned, we really are thinking about theory into practice. And so our assessments are really designed to kind of assess public health problems. And so what you might find of some of the assessments are peer reviews, multiple choice questions, written essays, policy papers, analyzing data sets, doing group work, doing video blogs. And that really gives you a flavor of what you might do in the real world in public health, but also allows you to apply your learning and do it in various different formats, which hopefully keeps it interesting and exciting. Again, we've got both formative and summative assessments. The strategy is that we think that you should really attempt those formative assessments to see how you're learning and how you're going along, especially in the online sphere, where you might not have as much context as you would sort of on a face-to-face program. But ultimately, you need to do the summative assessments, and those are marked by our staff and give you really good feedback and opportunity to learn. So with that, I will pass it on to Christina, who's going to talk a little bit about our student support model and the tutoring system.
Can I just add before you start, Christina, that this course is completely online, so there's no obligation at all to come onto campus. So you can do this in your own country and not have to attend any classes or sessions. You are very welcome with an Imperial degree to come to our graduation ceremony at the Albert Hall once you've got your degree. But there's no obligation to attend any of this. So it's ideal if you're working in your own country and you want to get your degree. I'm not sure I made that point early on in the presentation. Sorry, Christina, go ahead.
That's great. So I'm going to talk to you a little bit about the personal tutoring system and the student support services that are on offer for students that study within the School of Public Health and also within Imperial College. Now, along with the sort of academic content and learning that you will do, we offer the tutoring system, which generally provides support with general academic inquiries or issues that you might be having, and also sort of pastoral care, so sort of support your well-being throughout your studies. So when you join the GMPH, you will be assigned a personal tutor with a group of 4 to 5 other students. You will meet as a group once a term as a minimum, and we'll be able to discuss in that group any issues or problems that you're having, share with your fellow learners in terms of kind of good study skills that you have. You'll also be able to discuss general feedback in terms of how your assessments are going, how the course is going, are you struggling with the workload, and discuss ways of resolving those issues. Then the personal tutor will also be able to offer you one-to-one sessions where you can perhaps talk in confidence again about any sort of well-being or general academic issues that you're having, and they will then be able to signpost you to the relevant student support services that we have available within the college, most of which are available and fully accessible to online students. So, for example, we have a Centre for Academic English, where perhaps if English isn't your first language or you're new to academic writing, they provide a range of online courses and tailored workshops to support you. We have the graduate school that also run workshops in terms of time management, sort of general sort of ways of managing stress or well-being throughout the course, and also sort of financial support services as well if you have any issues and problems there. We also have a disability advisory service. So if you suffer from if you have a disability, then they can provide an assessment and also give you access to additional online tools which may support you through your learning and your studies at Imperial. Yeah, so I think that's what I wanted to say about the tutoring system.
Thank you.
Great, thanks very much. Oh, sorry.
Yeah, I think we're going to hear from Anna, I think, about the admissions process.
Yes, absolutely.
Okay, the next slides will show you how to apply for the program. So at the moment, as you have heard, we offering 2-year program, and we offer 3-year program, which you have to apply for the PGCE cert first. With regards to application process, you need to go to GMPH site on Imperial. You can also find it via Coursera. When applying, since the application deadline is 31st of July, we encourage you to attach all the documents necessary for the application, including references, including all the diplomas and all the other information that is required. Once our admissions team receive all the documentation and then process it, which may take 6 to 8 weeks, our admissions team will review it and we offer you a place. Once you have received our offer, we ask you to accept it and pay the 10% deposit. Once you are in, at the end of August, beginning of September, you will be sent information, a pack about the course, and you'll be invited to join our induction course online, which will tell you everything that you need to know to join the course, and then we'll in a few weeks time we'll prepare you to take the course starting October 2020. With regards to English language requirements, normally we require higher standard level for the English. However, in the light of the COVID situation and the difficulty of some candidates to get to the testing centers, we can accept also college standard level for English, and you can find more information at the link at the bottom of the slides, Imperial College requirements English. If you still find it difficult to get to a testing center, Imperial offers a 6-week online pre-sessional English program, which you can take if, for example, your English test results are not still on the standard level. Also, if you feel that you would like to improve your English, you can take an online 3-week program to get to help you get to know academic vocabulary, academic writing better, and to prepare you for starting of the program. You can also find information at the Imperial website. With regards to application deadline, as I mentioned, you can apply until the 31st of July. So we suggest you submit your application as soon as possible. And if you require any help and support because of the COVID situation, you can find more information on the college website, Imperial Study COVID-19. And if you have any queries, you get lost, you get stuck during your application process, please contact us at gmph-queries@imperial.ac.uk, and we hope you will be able to make your application soon.
Great, thanks, Anna. So as Anna mentioned, there's a lot of information on our web pages. There's a lot of information on Coursera. We really strongly suggest that you go to those web pages, and I'm sure you're asking questions about your personal situation. A lot of those are answered on the web pages, and I think that we're hopefully making it a bit easier in the coronavirus time to support you all to get your application in. And note that 31st of July deadline is really coming quickly. So with that, I'm just going to give you an overview of what we're looking for on the application itself. So what we are looking for, generally speaking, is a clear account of your interest and your goals, evidence of your professional research or other experiences, a research proposal, and a compelling reason for joining our program. So what does this mean in practice? And this really comes in not only your CV, your transcript, and your personal statement, as well as your references. So those are the main components that we're looking for. So you may be asking yourself, well, I'm coming from a different background. It's not biomedical, it's not a medicine background. I'm coming from maybe theology, and that's absolutely fine. We don't expect that everyone will have public health practice experience, but what we do expect is that you tell us exactly why you want to be on this program and show us evidence that you're interested in public health. So maybe that's you've done some volunteering in the past. Maybe it's that you've been doing lots of reading during coronavirus and it really sparked your interest. And so you need to tell us really explicitly exactly why you want to come to our program. Now, in our personal statement, you're asked to write sort of a one-page, maybe a little bit longer statement, which describes, again, all of these things that go along with the paperwork that you provide us. So we really are looking for you to explain, again, exactly why you want to be on this program, how your experience ties or how it doesn't tie and how it's driven you to come to the program. We have a number of people, for instance, who are in finance and just didn't feel it as fulfilling as they wanted, decided to make a career change. And that's great, and that's absolutely fine, and public health is what they wanted to do. So in this statement, we want you to think about the way that you're writing it, be really clear and concise, but tell us about yourself and tell us everything that we would get to hear if we were, for instance, on a call with you. Because this is your one opportunity to really shine through and show us what you've done, what you're excited about, and what you're interested in. We also ask, because the research portfolio is such a broad part of your application and of this study that you're doing with us, if you're on the 2-year program, to please write a small research statement. Or if you're applying for, and you already want to go all the way through the 3-year program, please tell us what you would like to study. Now, it can be a broad topic, but it really just gives us a flavor of what you're interested in, how it relates to public health, and that you're thinking about this really large component of your studies. We don't want this to be more than 100, 150, maybe 200 words at most. But again, it really helps us to understand where you're coming from, what you're interested in, and allows us to kind of support you as you start the program. Finally, the last thing that's really important is why Imperial. And I think sometimes folks who write their personal statements do a great job of telling us why public health, do a great job of telling us about their research interests, but they forget to tell us why our program. And I think there's some really good benefits to our program. So we really would suggest that you look at our web pages, look at the courses that are offered, think about your own interests, and think about whether this program is the right program for you and why that might be, and let us know. Because again, we want someone that wants to be at Imperial, and we're excited about studying with you all, learning with you all. But again, you just need to kind of tell us what we need to know to be able to then make a decision. And just to say that our admissions board is made up of a number of the team who teach and really enjoy reviewing applications, really enjoy thinking about who's going to be on the next program. And really are just not trying to catch you out on anything. We just want to know who you are, what you're all about, and why you want to come and join us. So with that, I think that we're going to now hand it over to Amber, who's going to talk about the Global Disease Masterclass, which is one of our courses that you saw actually occurring in term 1. So it's getting ready to start back up again in September.
Well, thank you, Kat. So hi, everyone. I'll just be giving you all a very brief overview of Global Disease Masterclass, which, as Kat said earlier, is a now term 1 specialization. So Kat, do you mind just going to the next slide, please? So GDM, so Global Disease Masterclass, is taught and led by Professors Tim Hallett and Professor Helen Ward, who's on the call now. And I also help out as a teaching fellow. And essentially it is split into 3 courses, with each course being 4 weeks long. So the first course is all about global disease distribution, and it really gives you an overview of disease trends around the world, both in developing and the developed countries. And it's a very interesting but good overview about you know, how do we estimate diseases, how do we measure them, what frameworks do we use, and there are a variety of different live sessions that we have planned every week throughout GDM. So I think we have 12 weeks of live sessions, and each live session we try and invite guest speakers who are experts in their field, or experts in the field that you have studied this week, which is why the second course of GDM tends to be where it gets more interesting. So Kat, do you mind going to the next slide? Thanks. So the second course of GDM is all about communicable diseases. And we split the 4 weeks into HIV, malaria, emerging infectious diseases, and TB. And like I said earlier, our live sessions really are where students like to get involved and join us, because we are often joined by experts in the field. But essentially each week we cover a very brief overview of each disease area. So we give a very brief overview of etiology, epidemiology, as well as looking at the treatment options available for that specific disease, or even prevention programs that are out there. And then the third course of GDM is all about non-communicable diseases. And so far these, the 4 courses that make up the last course of GDM is colorectal cancer, cardiovascular disease, dementia, and diabetes. And similarly to the communicable diseases course, again, we give an overview of the disease itself, the etiology, epidemiology, as well as the possible treatments and prevention programs that are out there for those diseases. And then moving on to how we assess you on this module. So there are 2 assessments, both are worth 50%, so they have an equal weighting. The first assessment is a written assignment, which is a local policy plan where we give you options. I think it's 3 or 4 communicable diseases, and you have to go and write a policy plan for that specific city for that specific disease. And then the second assessment for this module is to produce a vlog, so a 5-minute video blog where you will present a global policy plan rather than a local policy plan, which you had done in your written assignment. And this is for a non-communicable disease, and I believe it's depression, breast cancer, and I cannot remember the third one at the top of my head, but it's another NCD. The next slide, please. So the Global Disease Masterclass course is made up of lots of interesting videos where not only do we give you sort of the basic facts that you need to know in order to understand the disease itself, but we also have lots of interesting videos that include roundtable discussions where our specialisation leads, Tim and Helen, will have discussions with professors, experts, doctors in that specific field of disease that you're covering that week. We also include lots of interesting readings that are relevant to that disease area. And readings aren't just long papers and journal articles, but they also include podcasts and videos, again, that are related to that disease area. We have activities and discussion forums, and we like to sort of bring in students' discussion forums, students' comments and discussions into our live sessions, and sort of have a bit of a debate at the beginning of our live session on whatever question was asked or put to you that week. We have peer reviews, which are formative, and you mark each other on that, as well as formative quizzes, so MCQs. And like I said, GDM is quite different in a way that we have live sessions every week, and I'd say for the majority of our live sessions we always involve an external guest speaker to come in and discuss their area of expertise and their research and answer your questions as well. And we also have office hours where if you have any questions related to the content or the assessments, you're able to drop in and you'll have me as your teaching fellow answering any questions or queries that you may have. So yeah, that's it for GDM. That was a very brief overview of one of our modules.
Great, thanks so much, Amber. That's really helpful. I don't know, Helen, do you want to add anything else since you're also teaching on that, or you've designed the course rather and are the lead on the course?
Yeah, I think, well, Amber's done a great job in providing the overview. I mean, it's a fun course to teach. I think the students are fun because you kind of go intensively into something for a short period of time. So the purpose of doing it was that in addition to the methods that you learn, for example, epidemiology, statistics, and some of the more general approaches, we wanted to give some actual content on the major diseases that are challenging governments and public health sectors around the world. Because when you have done your Masters in Public Health and you get a job in public health, then the people you're working with will want to be able to say to you, right, we've noticed that we're getting a real problem with diabetes and we haven't had a review of our plan for years, so we want you to go away, do a quick review, come back and tell us what we should be prioritizing. What are we missing? Why are we getting higher rates than we would expect, or whatever? And so it's about really applied, or finding, first of all, where do you find the information from? How do you critique that information about how common it is, what the key things are globally and locally? How do you find evidence for what works? How do you assess that evidence? And then how do you apply that to your particular local area? So it's quite wide ranging, comes up with you being able to take a brief, if you like, and go and write a recommendation. So that's the whole purpose of the GDM. And as Amber said, it's one of the popular things is these speakers. So obviously when we were doing this, so this year it ran from February through to May, I guess, June. And so it was right at the start of COVID. And I think within the second or third week, we had some discussion about that. We then had people who were working to do early development of screening tests for coronavirus. Then in the HIV week, I remember that we had Sarah Fiddler, who they just published a big trial of a population intervention, and she came and students were given the article to read, and then she was there to answer questions. So we're trying to, in that, a bit like the research that Paul was describing, we're trying to give you as students access to the people, the world leading researchers as they are doing research. It may only be an hour for each specialization a week on these sessions, but you really are getting sort of privileged access to be able to have conversations with these world-leading experts, and that's one of the things that students really, I think, have found very helpful. So that's, yeah, you'd love it if you do it.
Great, thanks so much, Helen. That's really great to hear about this course, and I think you can kind of compare all the courses. Are all various and a little bit different, but I think this is a really good flavor of what you'll get if you join our program. So just to note, here on the screen, we have a number of useful links. So we've got the Imperial College webpage, the frequently asked questions. As I plugged before, there are lots of questions on there that have been answered. It probably falls into your category if you're looking at a specific question, as well as the college level guidance related to admissions. If you do have specific queries and you're unable to find the information that you need, you can email us, so please feel free to do so. So with that, we'll open up to some questions and answers. I know that the team has really been already answering your questions as we've been going along. But I don't know, Patson or Anna, if you wanted to see if there are any questions that are out there that we can answer live for you.
There are a lot of questions about eligibility. So which kind of backgrounds do we accept? So some were questions about people with dental degree, veterinary surgeons, microbiology, some areas not connected directly with public health, whether we will accept them, whether we require any math certification, a proof of math degree, because obviously we have statistics. So these are the questions that are coming at the moment.
Thanks very much, Jana. So as I briefly mentioned, we do not have any requirements for the backgrounds that you come to us with. You do have to have a bachelor's degree. You have to have finished that. You cannot be currently enrolled in any other degree, whether it's a bachelor's, a master's, or a PhD degree. So this can be the only degree that you're doing at the time in which you're studying with us. And we do have some qualification requirements in terms of the level of the degree that you got. So again, go to the website and please look at that. That being said, we do have a very wide variety of folks that come from various backgrounds. As we mentioned, we have a student who came from a theology background this year. We often do have folks who have a medical background or a biomedical background, but don't let that scare you off. We do not have a qualification for math, but what we do suggest is that when we look for in our applications is that you have some experience doing something kind of math related, so that we feel like you're kind of going to be comfortable in doing the stats and the epi courses. We have, if you are unsure about kind of the level that you're at and if this is the right course for you, we'd really strongly suggest that you go on and look at our open content courses, which are on Coursera. You can see our epidemiology and our statistics course, and it gives you a flavor of what we're asking. So it is a master's program, but we walk you through step by step, and in particular for statistics, Alex is wonderful, gets rave reviews for going slowly, being very clear, and making stats fun for those of you that might not think stats is so fun at the moment. So again, you can apply from any background. We do look at your quantitative skills as you apply. So again, in your personal statements, please do make note to kind of how comfortable you might be or what you might have done in your job if you didn't have a background from an undergraduate situation where you had math.
Yeah, so just to add to that, Kat, I mean, we do ask that you have a good degree of equivalent to 2-1, but we will look sympathetically at other experiences which may be equivalent to that. So if you've worked for a number of years in a public health department doing, you know, research studies and things, then that would certainly help your application. So although we need you to have a good qualification, if you don't necessarily have that qualification, we will take into account work experience too.
Absolutely, thanks, Paul.
But you do need to be relatively numerate. But as Kat has said, and actually what we've tried to do is make much of our content, or as much of our content as possible, available on the Coursera platform. So you can register and do the open content of that course without any qualifications at all, and get a feeling for how the course is delivered and how you might be able to cope in that subject. And Alex's statistics course is a very good place to start, but we also have open content for our epidemiology and also for our foundations of public health practice is also on there, I think. So try it out, suck it and see whether you like it.
And the Global Disease Masterclass.
Yep.
A lot of that online.
Yes, absolutely. Anna, are there any more questions that are coming through that you'd like the panel to answer?
Another question that keep coming is how we manage students with different time zones coming from different countries. Do they have to do research projects and assignment based on the UK systems, or can they actually use their own examples?
So perhaps I'm best to answer this thing as I head up the research portfolio, as we call it. We actively encourage students to look at their own environment and location and find a question that they want to answer, and would be very happy for students to use data for their own country, or to address a question that is specific to their country. So very happy for students to do that. So you don't have to answer a UK question or are required to use UK data or collect UK data. So more than happy. And what I suppose, rather idealistically, what I'd like to see coming out of this course is a sort of global community of public health practitioners and researchers who are both expert in their own sort of local situation, but have benefited from the generic training that we offer as well.
Great, thanks so much, Paul. And I think just to add to that, we do take time zones into considerations when we're doing our scheduling for the live sessions and the office hours. We do try and alternate those so that if you're on the kind of extremes from us in the world, that you've got an opportunity to join those if you'd like. But we do not require you to come to anything live on the course. And so that means if it's 4 a.m. And you're unable to join, that's absolutely okay. We also post anything that's live on our course pages so that you can re-watch the live sessions if you're unable to attend because of time zone or because of going to work or whatever it may be. And we also really foster a community-based and kind of collaborative environment where if anything is a question that you have that would apply to your peers, that you post it on discussion forums that are freely and openly available to everybody all of the time. And I think that's been a really great source of learning for our students. In terms of the assessments, there are deadlines for the assessments. That's because, of course, this is a master's level program or building to a master's level program. And that's really important, that you do turn this in on time, but there are windows, so you can start maybe 2 days in advance from the beginning of the term and turn that in.
Any more questions?
Another question is about our collaboration with different departments and different international public health organizations. How does it work?
I can have a go at that. I mean, this program is delivered by people from across the School of Public Health, which includes epidemiology and biostatistics, infectious disease epidemiology, which includes the health economics unit, primary care and public health, aging and neuroepidemiology, and clinical trials unit, and very recently environment and health unit. So there's a range of units within the School of Public Health who do contribute to this course. We get some input from people in other faculties or other parts of the Faculty of Medicine, so clinical medicine, and so on. In terms of other agencies, quite a few of the courses will have speakers and who come and either do some of the videos or come to some of the live sessions. So the Global Disease Masterclass, as an example, we have conversations with people from WHO or from UNAIDS or whatever. We also in the, well, Christina might want to explain the collaboration we have with the WHO.
Yep, so we're working with the WHO Health Emergencies team at Geneva, so the headquarters of the World Health Organization, and they're going to be developing collaboration with us a sort of special module on the health protection specialization, which will go into much more sort of the international, both strategic and operational approach to how you manage a health protection incident or hazard. Obviously using their expertise in the field, a lot of case studies that they've actually actively been involved with. And they have the expertise in those operational areas, and we have the sort of pedagogical know-how of delivering that online. So we're working together to do that.
Great, thanks. Are there any other questions? I think we've got maybe time for one more before we close out.
There are people also asking about job opportunities after graduating, depending on, for example, if it's a doctor who wants to do the program, or students coming from different backgrounds. So what they can do after they completed the course.
I'm happy to give this a go. I think it's a tricky one because public health is a really broad field, as you think you may know, based on kind of everything that you're hearing about coronavirus. You really can go into various different avenues depending on what you are interested in. And I think a master's in public health really does open up those doors for you. So whether you're a clinician that's had a number of years of practice and you really want to go a more population health route, potentially just even applying that to your own practice as you go around on your rounds or work at a private practice, that's a wonderful application of what you've learned. You're also able to go into the policy sphere. We have a number of students that go into local or national government doing public health work. We've got students who go into the non-governmental sector, do international work, and go into research in academia if that's what you're really interested in. And I think, again, our program really builds the skills that you need to be a public health practitioner. It gives you the theory, it allows you to start to apply those skills. And you may not become an expert in, let's say, colorectal cancer, for instance, but you'll have the tools that you need that if you are going to go into an area, research or policy-wise to address that you can start to build and research in the right way and learn in the right way. So not a great answer in the sense that I'm sure you wanted, this is what you do afterwards, but it's really broad, and we have wonderful career talks here at Imperial to help guide you. There's lots of folks that have taken various different routes in public health. I think actually everybody on the call today has had a different avenue into public health and a different career since they've gotten into public health. So there's a lot of options and a lot of people you can talk to depending on what you're interested in.
I just add to that because I think one of the things you mentioned was, for example, clinical folk. So both, well, not both, all of myself, Christina and Paul are all clinical backgrounds, have done public health, and certainly from my own point of view, I did my master's and I continued doing combined clinical and epidemiological research for quite some time. I think that doing a master in public health does give you really strong research skills, which you can apply in clinical practice and public health practice. I think that it's a very popular course with clinicians, whether or not you want to just completely shift into a more population focus, but also if you want to continue to be, so from my point of view, it was infectious diseases. I was working in HIV, sexual health. It was quite obvious that public health was relevant, but we have interest from people who are working in non-communicable diseases who come into public health to learn about how to really manage both the delivery of high quality services, but also health improvement at the population level. And we equip people with the skills to do that. And it's really valued, very highly valued in clinical leadership, I would say.
Yeah, I mean, I would definitely second that. Certainly all the jobs I've had in service, when they've known that I've got an MPH and a research background, they jump on that. And I've been the research lead in operational organizations where they really valued that. I've encouraged other members to get involved in research, to publish. So it really is a sort of a real strength.
And then one thing I also wanted to mention was industry. Actually, there's a lot of demand for people with public health skills in various types of industry, whether it's pharma companies and people running trials, through to diagnostic companies and other tech startups and so on that are really interested in this population approach. They're very generic and quite transferable skills. So yeah, they are highly valued.
And the basic sciences of sort of epidemiology and research skills and statistics are all usable in all sorts of fields. And in fact, the some of the elements of the research portfolio are being used across the Faculty of Medicine by other master's courses at Imperial. So they do teach you quite generic and widely applicable essential core research skills.
Thank you guys so very much for joining our call. I know there's a number of questions that have been answered. We really tried to give those answers back so that you could see them publicly on the site. We'll again send out information on the FAQs and answer any remaining kind of bigger questions that might have been unanswered. Thanks very much, Paul and Helen and Christina and Amber for chatting through more of the aspects of the program, as well as Anna for walking us through the admissions process. We hope you enjoyed this, and remember that the deadline is the 31st of July, which is quickly coming, so please put your applications in ASAP if you'd like to join us in the fall. Have a great rest of your day.
Great. Really nice to talk to you.
Thanks very much, everybody.
Thank you, everyone.
Thank you. Bye.
Bye.